Here I'm going to show you how to demonstrate the proper places to listen for lung sounds. Alright, so you're going to take your stethoscope, make sure your earbuds are pointing towards your eyes. You're going to place them in your ears. Make sure you're using the large diaphragm here, and we're going to listen to 4 spots on the left and 4 spots on the right, starting with the top lobes. Alright, so real quick, let's talk about the locations where we're going to be listening. The first location is going to be the apex. The second location on down is going to be the upper lobes. For our female patients, you can go lateral or you can go medial. For the third location, it's going to be your median lobes. Again, lateral or medial for our female patients. And then the fourth and final place we'll be listening to is going to be the basis of the lungs. Alright, so the first place you're going to listen to is going to be the apex of the lungs, which is going to be mid-clavicular, right here. You're going to coach your patient to take breaths in and out. Breathe in. Alright, you're going to move down to the upper lobes, right here. Breathe in. Breathe in. Alright, then you're going to the mid lobes. Breathe in. Breathe in. And the last place that you're going to listen to is the bases of the lobes. Breathe in. One more time. And you do the same on the opposite side here. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. And breathe in. Alright, so that is how you would actually listen to the front lobes.